Hello, welcome everyone to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative podcast. I co-host this show along with Alicia and Geraldine, who send their love in their absence. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. So excited that you've come back for episode 2 with Demetrius Kirk. This is part of our big umbrella on Black history in the making, more specifically, our special on becoming Doctor of Nursing Practice. And so if you haven't already, go back and watch his first episode where we learned about his journey to becoming a nurse. In this episode, we're really going to get into the details of what it means to become a doctor of nursing practice. Today, we're going to talk about the Doctor of Nursing Practice degree, also known as DNP, role and responsibilities of a doctorally prepared nurse, general idea of the curriculum, how he'll spend each semester leading up to graduation, his involvement and his availability to participate in organizations, research, and entrepreneurship during graduate school, what his support system looks like, how his mental health has been affected during graduate school, what he wants the community to know and the general public about being a doctoral prepared nurse, and what he's looking most forward to during this journey. We were doing this to bring awareness to the public on what it means to be a doctorally prepared nurse, but also inspire the next generation of clinicians so that they have a personal, intimate understanding of what it means to be a graduate student, to manage life outside of school, and just a personal glimpse and information that you're not going to get by visiting a prospective school's website. Before we get started, I want to do a quick little disclaimer. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a physical emergency, you should seek medical attention from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone you know might be having a mental health emergency, you can call 988. Demetrius, welcome back.
Listen, I've seen you do it on other podcasts, and then you've done it on mine. I don't know how you read that all without messing it up. Bravo to you!
Well, thank you.
You got to practice a lot because that was impressive. One take.
Yeah, thank you. Yeah.
Thank you for having me.
I think I'm working in my zone of genius. And so I think when that happens, it works out really nicely like that. And that's something you would understand.
Yeah. While I am a podcast host, it takes me like 7 times. So kudos to you for doing it and just perfecting it. I love just the introduction and the purpose of this podcast. And in this particular podcast, I'm on to talk about me becoming a DNP prepared nurse.
Yeah, this is super exciting. If you don't know, if this is your first time watching the Melanin Initiative or listening on your favorite podcast app, I did the BSN to DNP program from 2016 to 2022. I did it part-time, so I am still a new DNP graduate and really excited just to be in this space and to talk to you and to just kind of promote not only nursing, but graduate education. So let's get started. If you could just give the audience, in case they haven't watched the first episode, a brief little bio.
Yeah, so my name is Demetrius. I am a registered nurse by trade. I've been in healthcare my whole life. I started off as a CNA, worked my way up to LPN. After LPN, my 2-year associate, my BSN, and then my master's. Most recently, I began my journey down to becoming a DNP because I felt the need to really just be at the table. And to me, being at the table is not just sitting there, but making the decisions for the table. So my journey into nursing is one that's been long because I've done it my whole life, but it's still so much for me to learn and grow as I continue down this path of nursing excellence. I love to tell people by default, while I am a nurse, I'm very much operational based. So what that means for me and what that means for organizations that I assist is that when I come into an organization, I'm not only thinking about the clinical aspects, I'm thinking about the operational aspects. So I do hold an MBA in healthcare management. I hold my Lean Six Sigma Green Belt in project management, nurse executive certification, quality improvement certs, all different types of things. But what's most important is I use all of that to make healthcare better, make patient outcomes better, and change the pathways for people walking behind me, so it's easier for them.
Wonderful. And I have to say, you have quite a humble spirit, because you just gave us a little bit of your credentials, but you did not include all those lists of abbreviations after your name. I just noticed. But if you find him, like after this episode, when you go follow him on LinkedIn and all his other social media platforms, you'll see all those letters after his name.
There's time and place, and I think that for me, the letters don't define me, right? I'm probably one of, and I don't know if I can say this, my wife knows it, right? I'm probably one of the only students that would say, well, I'm not the biggest fan of school. It is needed for us to sit at the table.
Mm.
Um, as with most jobs, most of anything in life, right? You learn on the job. Certain things you can learn on the job. And I do recognize that while nursing, you can't 100% learn on a job, right? There is a need for us to have advanced degrees if we want to have our voice heard. Unfortunately, you can be the best nurse with best LPN, best 2-year, best BSN, but unfortunately, it's not until you put that PhD, DNP, DHA, something in the back of your name that people turn around and say, "Oh, let me hear the same thoughts you have today that you had before you got the degree." It's true,
That
but
sounded personal.
but I think it is right, and I've talked to plenty of people with DNPs and PhDs, and they echoed the same thing, right? I'm the same person. I just got a little advanced knowledge in whatever their specialty is. So for me personally, like I say, school is just one of those formalities I need to do so I can sit at that table and make decisions.
I love it. And so, yeah, that's a great segue into our first question. So if you don't know, there are two terminal degrees in nursing. One of them is the PhD, which everyone is quite familiar with. And then we have the DNP. It's actually not new, but it's newer. And so there still is a gap in knowledge when it comes to that. So if you can, how do you explain the DNP degree to other people when they ask you?
Yeah, so a DNP degree, you are essentially a nurse scientist. You are a person that's going to take what the the nurses with PhDs develop, their theory, their concept, their practices that they develop. And as a DNP, you're going to put that into practice. So you're still considered a nurse scientist. And I think that is something that needs to be said, because I think people think of DNPs as not nurse scientists, right? You do have a terminal degree. You are able to teach at the collegiate level. You are able to do some of the same things that the PhD can do. You can conduct research. It doesn't mean you're just stuck into implementation, right? But your specialty is going to be on that implementation side, where the PhD is the complementary to our DNP. They're going to develop that research. But I recently talked to a DNP student or DNP professor who was saying, without DNPs, it takes roughly new evidence-based practice over 10 years to get to practice from a PhD level. So you have to have those DNPs so we can get that to practice sooner, right? Imagine if we're just implementing evidence-based practices from 10 years ago. It's not going to work, right? It's not going to be as effective. So that DNP is a nurse scientist that is designed to improve clinical and operational outcomes, designed to still teach, but ultimately, right, you're more on the implementation side of things.
Wonderful. And so, since we have such a mixed audience and we really emphasize health literacy here, the way I usually describe it is like, let's say we conduct, because you mentioned evidence based, right? And of course, that's our language, right? But for like, I know my mom and dad who are going to be watching this, they're not going to know what we're talking about. And so, what I like to describe it is like, let's say we study 1,000 people and find out this one thing works really well in 1,000 people. Well, since it works so well, we're going to say that maybe it's not proven, but we have a lot of evidence to support this particular recommendation. And so it's evidence based on the evidence we collected. And so, yeah, it's interesting that you hear that, because I heard it was 17 years. So
Yeah.
maybe it's gotten better now that there's more of us out here.
Well, and the statistics may be longer. I didn't want to overshoot, right? So,
Hmm.
I remember as above 10 years, but ultimately, the point I wanted to really get across to the audience is that it takes a long time
Too
for
long,
something, for a concept to be delivered to the community, delivered to the masses, and ultimately, right, that could affect lives by the thousands, right? Imagine if we're coming up with a new way to prevent infections, and we need COVID, for example, right? You think about how fast they got those injections out there, right? So imagine, right, how quickly sometimes we have to turn around the evidence and get it to the public to save population.
That was a great example because actually I think everybody can relate to that, right? It just happened. And I think, on one hand, it's like, yeah, people didn't trust it because it was such a quick turnaround. But
Yeah,
then on the other hand, they're like, well, if you can turn it around this quickly, why has it been taking so long?
I'm gonna leave that on the table.
So, how do you describe the role and responsibilities of a doctorally prepared nurse?
I think it goes back to my original statement, right? Your role can be very much um, diverse. And that's because a DNP is the degree, it's not the person. And it's kind of like, I'm looking at the credentials behind your name. We will both have a DNP, but our roles may be different because you have certifications to practice medicine, right? I won't have that, right? You have your nurse practitioner, so just because I'm a DNP doesn't mean we're all equal. And I think that's what the public sometimes struggles with, right? Because I'll say I have an MSc and they say, oh, great, you're a nurse practitioner. No, I didn't. That's not my track. That's not my certification, right? So for me, when you talk about a DNP, I think you can do a lot of things. You are a nurse scientist, but you also can be an educator. You can work at the bedside. Just because you have an advanced degree, I know plenty of DNPs that work at the bedside, right? The DNP is the degree. The person can do whatever it is they want to do. I've worked with EMR companies upgrading and rolling out EMRs, right? I can do that with any degree. It just so happened I will have a doctoral degree behind my name. And ultimately, the biggest thing that I would say if you wanted to pinpoint something for you is when you have a doctoral degree, you're apt to gain those professor roles at higher level institutions. Whereas if you did not have a doctoral degree, you wouldn't be able to be a tenure professor or a track professor at a university or college.
Yeah, I love that you brought up the different settings in particular. And I have to say, I do feel a sense of responsibility when I walk into a room or I walk into a new setting to to show my colleagues, really my nursing colleagues, what the return on investment was on getting that education, right? Because maybe everyone thinks about it, whether they do it or not. Everyone has thought about it because from day one in nursing school, you are constantly told about the importance of advancing your education. And sometimes people are just looking for the evidence which have one of those little bells, to show if it's really worth it, what difference is it really going to make? And so I do feel some of that. I feel that responsibility, that weight on my shoulders. So yeah, I love that you brought that up. And I love that you brought up the bedside nurse, right? Because you can work anywhere. And I think there's certainly a lot of conversation around this degree because we take what we know and we use it as the barometer for everything else. And so we know the doctor track pretty well. It's pretty linear,
Mhm.
right? One way in, one way out. But with nursing, as you brought up in one of our previous conversations, I don't know if that was online or offline, you can get in through so many ways. And I've seen that for some, there's a group of people who love that, and there's a group of people who don't like it. And I think that has created some of I don't want to say confusion, but some of there needs
Yeah.
to be more clarity because just because you have advanced your education, it doesn't mean you have to step out of your role because every setting can benefit from having that advanced education because you are expediting that new knowledge that the PhD prepared nurse has generated and you're translating it. All the things we complain about on a day-to-day basis, that doctorate prepared nurse is able to do something about it.
You know what? You're speaking my language, and I think that's the difference, right? And it's very, as my wife would say, big of me to come full circle and say, okay, I can now see the reason why we are doctoral prepared nurses and the advancements through my studies, right? I can see that, and I'm understanding organizational and change leadership at a higher level than I did previously. Now, when I was an LPN, you couldn't tell me anything. I was like, and I'm not going to get into the debate, but when I was an LPN, I don't need to go back. But as I've advanced, each time I've advanced, I was like, I looked back and said, okay, maybe my direct clinical practice may not have benefited, right? I know your skills are your skills, right? You know how to calf. As you advance, your technical skills are not what's advancing, right? What you're advancing is your critical thinking, how you process, how you communicate, how you learn to work on a team. It's not the technical skills, because I always say the RN versus LPN. Technical skills are the same. I can shoot an IV just like an LPN or an RN, or vice versa. Some CNAs shoot an IV. We're not talking about technical skills as you advance. We're talking about the art of critical thinking. We're
Mm-hmm.
talking about the art of, like I said, team building and change management. That's what you're gaining as you advance your career. And sometimes that can't be seen because you're not in that room to understand it. You don't know what it's like. We've all worked with nurses and we've been those nurses. I hate going to work. They're always short staffed. They don't have this process. They don't have this. But you can't sit at the table because you didn't advance your knowledge base to bring something to that table so you can fix that issue.
Yeah, and like as I think I've mentioned, and part of my mission is just to promote the profession of nursing, what it means to be a nurse, because it's not just clinical, but because the primary image that's out there, movies, film, whatever, even our friend, even our sister, we just see the clinical aspect of it. And so it's been hard pressed for people to understand that advancing your education is not just that one benefit in terms of your clinical skill set, but everything you just mentioned.
Yes. So true. And thank you for allowing me to get that off my chest. It feels like I needed to get this off.
Yeah, and I love when you talk about project management, which is huge. I have, like, as I mentioned, I'm a new nurse practitioner, and that has been something I spend most of my time on, which came as a surprise to me. But I'm so glad that I had that opportunity to develop those skills. Something, you can continue to develop, but it's been a huge, huge benefit to me, and I think it's been a benefit to my team.
Nice. Very good.
So let's talk about your curriculum and what the remainder of your semesters are going to look like.
If the audience could see me, my head is down in my hands.
I guess we could start from the beginning too, though.
Yeah, so I'm only in my third class, right? So
Oh, okay.
my program did a switcheroni or did a switcheroo. This is one of the first times that they have attempted to implement 8-week classes. And the ultimate goal of my program was to get you done in 21 months. Well, as I just received the email yesterday, that is no longer the case. They now have to go back to 24 months. So with that being said, I have, 12 classes that are 10 weeks apiece. And it takes you through all steps, right? It takes you through everything. I've done theory classes. In this class, I'm talking about organizational leadership and operational change. And at the same time, right, I'm starting to work on my thesis or dissertation. And I'm working on chapter 1 and 2 as I speak now. So I think the coursework is the coursework, right? As I tell people, no matter what doctoral program you're going to, you're going to have papers, you're going to have PowerPoints, and some either discussion posts or journal. You're going to get that. And if you're studying nursing long enough and you start going BSN and MSN, you know to expect it, right? So for me, I think the coursework and the work that I'm doing is just going to overall prepare me to be a better nurse and be a better contributing partner to the nursing environment.
Yeah, for me, like, a big chunk of that program is the project. And it
Yes.
starts from I know for our first semester was they called it a DNP residency. And
Yeah.
it was really just kind of understanding the history of education, work in terms of the doctorate level, what our roles could be, and then kind of like the whole project and why that was even important. And then we went from ideation, coming up with an idea, where could this be implemented, and then working that baby idea into something grand. So each semester you're kind of chipping away at this
Yeah.
idea, and then
Yeah.
it just continues to grow.
100%. And so for the way that my program is doing it is you're working on your paper, kind of like you said, simultaneously at the same time. So my third class, we're going to finish up chapter 1. My next class that starts in March, we'll finish up chapter 2. We get a small break in between for a class, and then we go back to chapter 3. So I mean, it's like you said, you start off with a PICO question. For my people who don't know, you start off with a thought process, right? A hypothesis. Nurses, we love fancy words, so we get to call it a PICO question. It's just a hypothesis. But you start off with that, and then, like you said, you start to snowball it, as I'll say, into this big thing. So when you're at the end, you have this 5-chapter dissertation or thesis.
Oh, okay. Is that what yours is? The goal is to get to 5 chapters?
Well, it's not my goal. Let me be clear. This is not this, as you said. The expressions of the podcast is not me. That's not mine. That's just the requirement, right? So you have your chapter 1, which is just your overall research. Then my chapter 2 is the literature review. My chapter 3 is I think implementation or something along the line. 4 is results, and 5 is dissemination.
Okay. And what's your topic?
So I'm going to do, because my specialty area is risk and compliance, so I'm going to do a fall reduction program or a fall reduction intervention. So we have the Morris Fall Scale. I am implementing that at a local facility in Michigan. My goal is to hopefully decrease falls. 1 in 3 seniors fall each year, more than twice. And of that, most of them, 2 out of 3, will receive a hip fracture right after that second fall. And as we know, as healthcare providers, for our senior population, I'm talking really for people over the age of 65 who sustain a hip fracture, there are a lot of other comorbidities or complications from sustaining a hip fracture that people wouldn't think about, right? So my goal is to prevent them from falling in the first place. And that starts with us as healthcare providers, healthcare team members, properly assessing them to see if they're at a risk for fall. And if they are, putting in the evidence-based interventions to prevent them from falling.
Yeah, so when I was a baby nurse, I did a nurse residency, and our topic was kind of assigned by the manager, who it was one of the indicators they needed to track.
Mhm.
And so we were given falls, but actually it became a real kind of passion project, right? Because it's such a huge problem, and I feel like we spend more time convincing people that they're at risk for falling than we do anything else. That and skin, trying to convince people the problems associated with the largest organ of your body and the falling, because maybe you've fallen before, or you don't think you're gonna nobody, and
Yeah.
I tell them all the time, nobody thinks they're gonna
Well, no,
fall.
listen, we're all a fall risk the moment we move. I'm a fall risk, you're a fall risk. Anybody who's
Yeah.
walking, ambulating, or crawling, right, we're all a risk for falling. Things can happen. The ground can give out. Your shoes can come untied. Things can happen. My project focuses on the nursing intervention side of things because we know patients will be patients, and we can't fault patients for being patients. But
Yeah.
what we can do is anticipate their needs and try to meet them where they are. Because as we've talked about on our last podcast, right, you echo health literacy in a way that they understand it. If they've been independent for 65 years of their life, who am I to come here and say, you can't just get up and walk to the bathroom? Sit down. What are you doing? You don't have no right. No, that doesn't work. So
It does.
I have to anticipate their needs. If I know every 2 hours you need to get to the bathroom, I need to be in there at 1 hour and 55 minutes. If I
Mm.
know you're going to want to get up and meet your loved one at the door, then maybe I need to be in that room with you, right? I need to prepare you. I need to make sure you have that call light. And if you do choose to get up, I need to make sure you have your grippy socks or whatever right near you. Your assistive device, as you walked in the rooms, is over there across because the CNA or the nurse was doing something and they forgot to put it back, right? I need to anticipate your needs because patients will be patients and we can't fault them for being human.
I love the language that you're using. It's so compassionate, really. Is there going to be any tech in this paper? Because as you mentioned, that's like the competent patient, and I can only imagine. I'm thinking every time you said the things, I'm thinking about the dementia or the person who's delirious or under some influence. And so I know a lot of times we had those cameras,
Mhm.
depending on what facility, might have a different name.
Listen, so a couple things. One, I'm doing it in long-term care, so this is considered their home. So we wouldn't be able to use any cameras, and apparently restraining people is illegal. So we can't use bed alarms, we can't use chair alarms, right? So it's gonna really function on the facility's ability to do purposeful rounding, right? And that can
Mm.
be an intervention. My project is just to say, hey, here's a tool you can use. I'm not really implementing the after effects, right? What I've identified is every nurse is assessing differently. You're using the Morris Fall scales, you're using the trips.
Mm.
What if we go to a standardized way of assessing? And that's the purpose of mine. So, I'm only looking at it from that level. from there, they have to put in their own evidence-based interventions and things, right? And that can be a laundry list of things that they can put into place. But I think if we all start from the same assessment pool, we'll be able to analyze the data, right? To see if this is effective. But we can never analyze data if I'm assessing one way, you're not even assessing, and you just do something that you saw on General Hospital.
Ooh, are you dating yourself with
I
that?
did. I did. I'm sorry.
That's cool. So you mentioned long-term care setting, and so part of this student's responsibility is finding a clinical setting. They encourage you to pick a problem you can solve at your workplace because it's easier. Is
Yes.
that what you're doing?
So I am an administrator as well, and I don't know if I shared that at the beginning of this episode. So I'm a licensed nurse, and I'm an administrator, licensed hospital administrator as well. So my comfort area, I've always worked in long-term care, is nursing homes. So this particular home that I picked is not one that I currently worked at, but it's one I was previously an executive at. So I know the ins and outs, and I know what they really need because, as you guys know, potentially sometimes the public data that's up on the website may not be as accurate, and it may reflect that you don't have a problem when you actually have an internal problem. So I picked somewhere that I knew I can get accurate information from.
Mm, I read between the lines there. So how much? Okay, so how much time do you have to participate in organizations, research, entrepreneurship?
Yeah, I think it just depends. For me, I developed a strategy when I got my BSc in where I kind of sit down and I do all of my discussion posts on like a Sunday, and then that leaves the rest of the week for me to kind of do multiple days of work on a paper. By default, we have 125 clinical hours that we have to do per class. So it breaks down to 15 and a half hours a week. And then on top of that, I have my regular coursework, which is probably about 4 to 6 hours worth of coursework a week. So, I think it just depends. It's hard to quantify, but I have a family, I have a spouse, I work, I have a 6-year-old. So, as I've shared with them, it's just about buckling down for this year and a half, 2 years I'm in this program, and then we get our lives back. And dad is a doctoral prepared nurse. So it's hard to quantify it, but if I had to put a number on it, about 22 hours is used for school a week, and it's not consecutive, right? That's over the course, and you're counting your clinical hours as well, which it's in there.
You mentioned clinical hours. So is this like, you mean what's being contributed to the project?
Yeah. So we have to do 125 hours of things related to the project. So it can be meeting with your preceptor, your chair. It can be talking to the facility, touring the facility. There's a whole list of 1,000 things that counts towards those hours, that will help you meet that commitment. But you have to have 1,000 hours.
Okay, wonderful. So you kind of mentioned your family. We can talk about what your support system looks like. And what does it mean when you say, I have a supportive spouse?
I don't know if I said that one now. I said I got a
You,
spouse, but
oh, the supportive part?
I don't know if I said support that though. My wife, my wife is very supportive. My 6-year-old is supportive for what it's worth, right? Um, Family to me is important. They have to be on board for this, right? Because the things that you used to do, I cook every day. I'm the cook of the family, right? So I can't cook every day because some days I'm working on a project, I'm obtaining clinical hours. So, you have to have a good support system to me if you want to be successful. Doesn't mean you can't be successful, but it just makes it that much easier because I'm not arguing with my spouse. I'm not arguing with my kid to say I have to stay home and get this done, right? They understand the time commitment that we're doing. So I think for anybody going to get a bachelor's, master's, a doctorate, right? Try to gain the family's buy-in. It just makes it so much easier, right? In my younger days, right, I was sad. I'd lose friends, especially when I was becoming an LPN. Why are you doing that? I became an LPN when I was 20. Why are you doing that? We're partying and all that. No, no, no. No, I got my course structure, which was just my wife at the time, and we agreed that this is what we were going to do. She understood and still understands to this day why I'm advancing myself. But ultimately, if I'm being frank, benefits my family, benefits my wife and my 6-year-old. But, for me, it's important to have a great support system, and I'm blessed to have a great support system.
I couldn't agree more. That's one of the things whenever I do talk to aspiring students, I say don't even get started if you don't have everything organized, and that includes your support system.
Yes. I'm glad you tell people that, because a lot of times people don't have that and they're not thinking about it fully. And I know this is a DNP podcast, you're talking about that, but just in general, right? How do you plan? And people, I call it a triangle. And somebody told me this when I was going to school, right? You can do two, you can go, what is it? You can study, sleep, and party. You can only do two. But if you're in nursing school, which two are you going to focus on? Study, sleep, and party. Which two are you going to focus on? Because if you partying and sleeping, you ain't studying. If you sleeping and studying, you ain't partying. If you partying and studying, you ain't sleeping then. But you can't achieve all three. I ain't met nobody yet that's saying, look, man, I sleep, party, and get great grades in school, right? Because nursing is one of the only programs, I'm sure, physicians and things like that, where that B in nursing school is not the same B that you used to get into this program. I got the nursing school. I said, what do you mean a 94 is a B? I said, what? All my life I've been getting 80s and it's been a
All
B.
my life.
And I get to nursing school and then you hit me with some select all to apply. Sorry.
Oh,
You saw I got a...
That's a trigger word over here.
Yeah. I'm sorry.
Ooh.
What do you mean? That's... How come I never heard of that before? Why are you trying to trick me? This ain't real. Sorry.
Yes. Oh man, you brought it back. When I took my NCLEX, let's say that they said there's 75 questions, right?
Yes.
Unless you require more. If say I had 75, 50 of them were select all. I knew I failed.
That is me, and what I've learned over time, because I've had the pleasure of working and seeing multiple people take the NCLEX afterwards. And it's one of the things you can do as a nurse people don't know. When people have anxiety, depression, whatever, and they require like an Ativan, a lorazepam, a Xanax in the middle of a test, they need to have a nurse on site to administer that. And you get to sit there in the room with them. So I've seen multiple NCLEX, multiple different certification tests because everybody got anxiety and needs Xanax. But what I've learned is if you're getting a select all to apply, those are the highest level questions and you're actually doing well. I know it doesn't seem like it when you're doing it. Like, I want a true and false, but really in the grand scheme of things, you don't want a true and false because that means you're not doing good.
Yes, so I've heard. So you brought up anxiety, right? So let's talk about how your mental health is being affected during graduate school.
I think for me, I have the motto that I know it just needs to be done. Mm-hmm. I'm not afraid to, talk when I need to and, release when I need to. So I don't let it build up, but I do think mental health is important, and I can understand how some people struggle with it in nursing school or obtaining an advanced degree. All the responsibilities, I'm a lot better now, but when I was going to be an LPN, my mental health was not the best because I was in a nursing school LPN, and if I failed, the school was closing. I couldn't come back next year, and I was paying cash. The anxiety that was there, this is a little bit different, right? I'm already a successful clinician. I'm doing this because I want to do it. So for me, it's a little bit different now. Doesn't mean, everybody's journey is the same, but for me, it's a little bit different now. You may know, but I know the viewers don't know. I live in Honolulu, Hawaii. So if I get stressed, I walk across the street to the beach and sit down. It's 85 degrees right now. So, that helps me though, right? That's one of the things, like you say, when we talk about mental health, I have interventions in place should something happen. And I think that's what's important for people is to not be afraid to reach out, not be afraid to communicate that, hey, I'm feeling stressed. I have anxiety, I have depression. You don't have to deal with this alone. You don't. And I think that's what's important. And I can speak for me. I can't speak for all the African-American community. But a lot of times we don't seek help. I know I was taught growing up, you don't go to therapy, people don't do marriage counseling, things like that. It's 2024. You get help where you got to get help. You call whoever you got to call and you speak about the issues that you have. You are not alone and you don't have to go through it alone.
Beautifully said. I thank you so much for sharing that. Yeah, I kind of recently realized how much anxiety is really associated with nursing recently, and it looks different at different levels, right, and in different settings of your career, even. And I think that's certainly a topic that needs to be delved into a lot more.
Yeah, I mean, and you said career, right? Because we will, once again, I go back, we will both be doctoral prepared nurses. My anxiety level may be different because of what I do versus what you do from prescribing and treating patients, right? I sit behind the desk and punch keyboard. It's a different level of anxiety. Am I going to have dinner ready when my wife gets home? But you're taking care of lives and things like that. So everybody's anxiety level is going to be different, and how they deal with stress is going to be different, right? So thank you for asking that question. And I'll say this before I turn it back over. It was very interesting. I don't know if you just saw it, but Elmo recently just asked everyone how they were doing. I don't know if you
Elmo
saw that. Elmo on Monday, he tweeted,
Sesame,
"How is everybody?" Elmo
from Sesame Street.
on Sesame Street. He
Oh,
got over 8 million replies, and a lot of people was just trauma dumping. I'm not doing well. And then he was on Good Morning America. He was all over. Just that single tweet. And he's a 3.5-year-old. And he thought to ask people how they were doing. And Sesame Street said they didn't think they would get that big of a response.
because he says it all the time, actually.
But
Isn't
he's never.
his tagline?
It is for Sesame Street, but he tweeted this.
Oh,
You got to go back and see it. And once you do, I mean, people are like trauma dumping. They used him as a way, and then people are even saying like, "I thank you," because think about it. How often does somebody genuinely ask you, "How are you doing?" Not "How are you doing?" How is your mental health?
if you're gonna ask, I'm gonna answer. So as I said, I'm a new provider, and I've had these mental health surprises. And so what my mom started doing to support me, because we talk every day. And so instead of saying, "How are you doing? What are you doing?" we start off with, "How are you feeling?" And through her training as a chaplain, she learned about the feelings chart. And so that's how we start our conversations every day. And that's been super helpful.
I love it. And I have a 6-year-old, and I'm teaching her to talk about her feelings. I'm a little I'm still a guy dad, a girl dad, but I think this is important is that we talk about our feelings. And my daughter has seen me cry, right? I'm not afraid to be vulnerable. I'm not one of these guys. Maybe it's the millennial me, but I'm not one of these guys that I got to be strong and stuff, and you can't see it. No, what you say hurts my feelings, and I'm a cry. And you have to understand there's your words mean something. You can't just go out there and say whatever or treat people how you want to be treated, and not think that there's something happening. Just because you don't see it doesn't mean a person is not processing it wrong in their head, right? So I'm purposely vulnerable in front of my daughter so she can see what that looks like and not be afraid to be vulnerable as well. Because if we go back to what happens when people hold it in, let's talk about it from the health perspective. Strokes, heart attacks, right? I mean, the list is long from when you have this level of stress and you're just holding it in.
Yes, and you're doing such a beautiful job. She's going to be well prepared for whatever kind of relationship she enters, because she had that experience with her dad first.
Yes, thank you.
You've kind of given us a pretty good glimpse, but is there anything else you want the community or the public to know about being a doctoral student?
I think not necessarily about being a doctoral student. I think we just need more people in nursing. You hear about the nursing shortage all the time, and I got my views and opinions for another podcast, but I welcome anyone to reach out to myself or someone if you have some thoughts about entering the field of nursing. No, it's not what you see on TV, right? This isn't Scrubs. This isn't House. This isn't any other doctor show that I can think of, a nurse show, right? You're dealing with people's lives, and I want you to come on in the field if you have a compassion for helping people. If it is your mission to help people and serve others, we need it, right? Because one day I'm going to need a nurse. I mean, I need a nurse now, but we're all going to need a healthcare professional. And, I do understand that, the job is hard. It is long hours. The schooling is hard, right? But I tell everybody all the time, if it was easy, everyone would be doing it. And you wouldn't want everyone to be doing it. You don't want Joe Blow, who you was just at the gas station with. Next day, he walks in, he's a nurse. That's not what you want. You want somebody who understands and who's compassionate. So, contrary to what people say, and I welcome people to just think about entering the field of nursing. And because, as we've talked, There's different levels of nursing, right? You don't always have to come in at the master level, the bachelor level. You can go and be an LPN. You can go and be an RN. Just come into the field. We need you, and more than we need you, the patients need you.
Excellent, excellent. And so, what are you looking most forward to in this journey?
Graduating. I'm sorry.
Reflex.
Yeah, reflex. So to me, what the doctoral degree has already done is started to open doors. And it's every degree that I've climbed, it has opened doors that I could not see. And I think what happens for us when we're sitting in our stoop, right? And I use this analogy all the time. When we're sitting in a stoop, it's hard to see what that person is doing up there. We can assume with that person because we're looking up, but we really don't know what they see from their vantage point. And I preach that all the time to leaders. And it's the same for us. So I say that because when I was an LPN, right, I'm like, well, there's no difference between an RN. But when I became an RN, and once again, technical skills did not change. Technically is technically. The critical thinking and the mindset open. So at the doctoral level, technical skills are still the same, but the opportunities are now opening up. The validation that I'm able to give organization is a lot more credible in some people's eyes, right? So I think that as I in the DNP journey and welcome and walk into a world of DNP, I'm excited to just be able to, like I say, sit at the table, make decisions, and make decisions that's not only going to impact the residents or the patients that we're taking care of, but the generations behind me. I know that as a DNP prepared nurse, I'm breaking gender stereotypes, gender biases, everything, right? I'm an African American male that will have a doctoral degree. First of all, last time we checked, it was like 8% of us as males. And that's at the associate to BSN level. As you start getting higher in the clouds, the air gets really thin, right? So I know that when I do it, I'm showing somebody else who's black and brown, white, blue behind me that you can do anything you want to set your mind to.
That's so beautiful. And again, I thank you so much for allowing us to follow your journey, to inspire another generation, and to show the public what it means to really be a nurse.
Thank you for having me.
This is a special episode. It is our last one for season 2. We're going to be on hiatus until May, coming back strong for Nurses Week. We're going to be delving into women's health, men's health, a lot of episodes dedicated to pain, and a lot more surprises along the way, with big emphasis on just health literacy, making sure that everyone understands, has that general foundation so that they know how to start the conversation, they're empowered to navigate the system, and that they remember that they don't have to do it alone. Remember, everyone, you can email us your show questions or ideas to tmi.melanin@gmail.com. Subscribe to our YouTube channel and follow us on Instagram, TikTok, Facebook. Ooh, and thanks to our friend here, Demetrius. We're actually on everything. We're on everything now. We're on LinkedIn. We're on Pinterest. Please share the show with your friends. Rate the Apple Podcast and Spotify. Leave a comment. Leave a comment everywhere. It really helps the show get more support and gets the message out there to those who really need to hear it, which is why we're even here. You can find all our social media links and list of any resources that we brought up today in the description box. We release new shows weekly on TMI Tuesdays at 10 a.m. on YouTube and all your favorite podcast apps. Please follow, like, and share our content with all your friends. Thank you, Demetrius. We'll be keeping you in our thoughts and our prayers. We look forward to reuniting with you at the end of your semester. We know it's going to be productive, but most importantly, it's going to be one more way for you to fulfill your purpose here on Earth. And we're so grateful that we're able to just be a witness to that.
Thank you.
Thank you, everyone. Thank you, Demetrius. Thank you for watching.